Premier Scott Moe says he received feedback from the public that their mandatory mask mandate that went into effect on Monday and only covered 2/3 of the province was confusing. So as of Thursday, it's going to cover the entire province. Other measures announced include restricting visiting in long-term care for only compassionate reasons. Private gatherings have gone from 10 down to a limit of 5, and the province is prohibiting party buses and limousines. All changes come into effect on Thursday.
Our numbers in this province are not good, and the trend is in the wrong direction. We have too many new cases, we have too many in hospital, and we have too many in intensive care. And we need to do what we can to get these numbers down.
Moe says if you want to meet with someone in your bubble, don't do it in your household. He prefers you go into a restaurant. He says the goal is to avoid another lockdown. He says a future lockdown would cost more than the 15,000 jobs that haven't returned from the lockdown in the province in the spring.
Each and every one of these numbers represents a Saskatchewan person. They represent our friends and our neighbors who happen to have contracted what is a very dangerous disease. Most will recover, yes, but some are going to get sick. Some are going to end up in hospital, as we have many in there today. Some are going to die. And that's why we need to slow the spread of this virus in our communities. And that's why we're taking these steps today. This is not a lockdown. This is a slowdown, a significant 1-month slowdown.
Chief Medical Health Officer Dr. Saqib Shahab says infection and hospitalization numbers are going in the wrong direction. He says on average, an infectious person is infecting another 3 to 4 people. He says average new cases could be over 300 before the effect of these new measures is seen.
I don't think we're going to go to less than 10 cases a day during the winter, but we do want to come down to 60 to 120 cases a day.
Last week, Premier Moe said no restrictions on businesses were currently under consideration, but that may change. He says his government and officials are going to meet with the hospitality, worship service, and sports organization sector in the coming days, and changes could be announced next week. As for modeling, Dr. Shahab says an update on models for cases, hospitalizations, and deaths is coming on Thursday. Adam Hunter, CBC News, Regina.